Um, I'm very excited to give a presentation on MMPI-2 in this group that most of my presentations, audience is MMPI researchers. And so I'm excited and nervous, but I'd like to hear about your feedback on my presentation. Okay, so the topic is the use of Korean MMPI-2 in Korean clergy applicants. I think that the better title will be Koreans because I don't have experience treating or dealing with the clinical population nor job applicants. So I am quite familiar with Korean culture as I born and raised in Korea, and quite familiar with the Korean MMPI-2 because I translated and adapted into Korean language. So just let me be clear that I'm a personality psychologist, not the clinical psychologist, so that my experience is quite limited just within a research area, not much clinical assessment. Okay, first of all, I'd like to acknowledge help from my graduate students, Jibing and Brianna, who helped me to constructing this slide. Okay. Okay, there are three objectives for this topic. First of all, I'd like to talk about Korean unique culture factors to be considered when working with Koreans in general. And then I'll talk about the difference between or similarity between English version and Korean version of MMPI-2, and briefly introduce the several stages of adaptation of Korean MMPI-2, and a brief introduction on psychometric properties of Korean version of MMPI-2, and then move on to learn some factors to be considered in deciding which version of MMPI-2 should be used. And the third topic is my knowledge is somewhat limited because of, again, it's based on only research, not based on my clinical assessment. Get the first objective, and I will start talk about general philosophy and values and religions of Korea, and then move on to personality and psychopathology. Okay, so first, and if foreigners come to Korea and spend some time with Koreans, and they might surprised to observe that Koreans tend to or easily change their philosophy or value system depending on the situations, and which is very nicely summarized as follows. Says in contemporary Korea, the average person will reveal some degree of Western rationalism and Christian thoughts in his or her office, school, or public affair. And Confucian element predominate, however, on the New Year Day in home life and in ancestral worship ceremonies, and in senior-junior relationship, which are often determined by age. During age, or at the abrupt loss of beloved ones, at the funeral, Buddhist elements become prominent. And when helpless, in despair, or during unbearable trauma, Koreans readily depend on shamanistic elements. So that this illustrates a very diverse or complicated relationship between these diverse value and philosophy which form guide Koreans' behaviors and values. Okay, there are three main roots of Korean philosophy and value system. We'll talk about Confucianism and shamanism and Buddhism. Confucianism is originated in China, and it's a product of patriarchal, strongly male-dominated society in China. But we consider the most important philosophy underlying the Korean collective personality because it was the official ideology of Yi dynasty very recently, over 500 years. There are many teachings of Confucianism. The main thing is it's a hierarchical relationship and within an in-group. So there's this clear distinction between in-group and out-group, and the home and family and in-group is much more important in the Koreans than out-group, which is the society. And so then the teachings say very little about how people behave in public. So that when the foreigners come to Korea and they're very surprised that they are very kind and generous to their family or friends or people they know, but they appear to be very rude or not caring to outside of their group, and we call it out group. And because of that behavior is rooted in Confucianism teaching. And the other feature is that the relationship with parents and family, especially parents, is the starting point of all the relationship. So that pleasing parents and do whatever parents say, and that is something that it's because of its hierarchical relationship, it's the given and accepted, especially for offsprings. And there is a two side of this, the close relationship with the family. The first one is you get constant support and the warmth from family. At the same time, because of it's a too much close relationship with the intertwined and a lack of independence, and young people tend to object sometimes and suffer from this very close relationship. So here I'm going to toss some of the very findings that I see in my research. This is an MMPI item, item number 522, says, even without my family, I know there will always be someone there to take care of me. So think about this. Here we have, let's say we have two groups. So American adult from general population, and here is the Korean from general population. So think about what percentage of American will say true on this item, and what percentage of Korean people say true on this item. You don't have to say percentage, but which group you think would be larger? What I found, American men, 50%, half of American, actually this is based on the American normative data, MMPI, say that there are other people out there who take care of me. They believe that, whereas it's 39%. It's lower than American people. So that this suggests that family is the main sources of you being taken care of and then being support. What about this one? This might be tricky. Once in a while, I feel hate toward members of my family whom I usually love. This is MMPI 2, item number 256. Which group do you think will be higher percentage of saying true? Korean. Interesting that I said that because of they're so closely related and they have to accept whatever parents say, and Korean somewhat, based on this, the report, we can infer that Korean maybe resent more strongly. But again, we have to be careful because I talk about how Korean MMPI 2 was translated, when you actually compare these mean differences or frequency, you have to assume that Korean MMPI and American English version is equivalent. So let's assume that those are equivalent. And then you can make these direct comparison. Okay, so without that, we call it cross-cultural equivalence, these comparisons it's questionable. But let's assume it is equivalent, and then we can make some kind of interpretation based on their responses. Okay, next one, the shamanism, which is the oldest religion of Korea and dating back for long years of influence. And this is what we consider source of Korean nation's spiritual energy. It's interesting because Confucianism is a very male-oriented the teaching, and a woman is second citizen to male, whereas shamanism is developed to fulfill the needs of women. So the shamans and clients predominantly women. And the shamans as being a household therapist. So when, in old days, it's changing, but in old days, when women have physical or psychological problems, they consult with the shaman, which tend to be female, and it's more like they're gossiping and get a treatment from, kind of informal treatment from a shaman. This is we call the gut, which is shamans conducting this ceremony or ritual to protect or keep peace at home through feasting and entertaining restless ancestors and ghosts and angry household gods. And based on shamanistic belief, and it claims that household the gods and then the ancestors bring you either happiness or misery. So that it's very important that you celebrate your ancestors. And so nowadays these ceremonies, it's disappearing because of the government banned these ceremonies, but still the people go to fortune tellers, and then whenever they make an important decision. So for example, last week, my graduate student who is a Korean, and she tried to set the defense date, her dissertation. So she told her mom, and mom said, okay, wait, I have to talk to my fortune teller to pick the best date so that you can pass. So still, Koreans, you probably heard that it's the internet system is amazing. Everything is so fast, yet they're very still stick to this old this Confucianism and shamanistic belief. It's very, very hard to, drop. So again, this is a little quiz, and this is MMPI item 2, item number 490, and says ghost and spirit can influence people for good and bad. Which group will be higher? Koreans, obviously. American woman, only 10% says true, and then half of Korean women still report that the ghosts and spirits can influence people good or bad. Okay, the next one, Buddhism. Buddhism it's introduced to Korea in a similar time as Confucianism, and about 25% of South Koreans still identify as a Buddhist. An interesting fact about the religious affiliation in Korea is about 45% of Koreans report that they have no religious affiliation. And so Buddhism is one of the major the religion still in Korea. There are two main impacts of Buddhism in the Korean communication. And the first one is the importance of silence or telepathy, and the distrust of words, and then the egalitarian aspects in the communication. So that it says, and people don't like the people who talk too much, because best communication is you read somebody's mind without saying. So you have to understand not without talking, and so which is sometimes it's source of miscommunication. But still, Koreans don't like people who talk too much. And then egalitarian aspects of communication, which is a sharp contrast with the teachings from Confucianism, because Confucianism say, okay, here's my in-group, and I take care of own in-group, whereas Buddhism thoughts that, the beliefs that we are all equal, and even little spider are just reincarnation of the human, so you have to treat them all equally. So there's a quite good balance about those two contrasting systems. I don't have MMPI item for this one. Okay, next one, there's so many personality and psychopathology that are unique to Korean, but I'm going to just pick a few. So the first one is called Han, which happened to be my last name, but it's a different meanings. And my Han is it's a country Han in Chinese character, and this one, it's a chagrin or grunge or the heart burning. And this one, Han, is feeling of unresolved sorrow or torment and resignation in the face of injustice. And it's a prince defined as something accumulated and precipitated and formed in the mass in the depths of mind in Korean people as they have experienced emotional frustration. And we use this Han in everyday language, like Han of country and Han of family and Han of woman. And it was argued that historically it was because just looking at the map, Korea is a very tiny country, which is about the size of Indiana. But there's a strong, very powerful countries surrounded by us and invade us historically, repeatedly. So there's a Japan, and then there's a China, and then there's a Russia, and all invaded us in the past. So that people, this personal collective Han, which passed through the generation, it's ingrained in our system. That it's although these young people these days doesn't have that Han, but it was it's almost through the parents. Do you feel this one? So I'm going to give a little bit of interesting. The article that I read, I don't know anybody recognizes. It's Olympic female figure skate. Not too long ago, there was a competition in 2014 Olympics, and then the girl on the left, her name is Yoona Kim, and she was the champion, the Olympic medalist 4 years ago. And so she competed again this year, and she skates perfectly. There's no, but she ended up placed in the second. And then the figure skater in the middle, she's from Russia. And then somehow the judges favor her, and then she placed the first. And so that, and Yoona was crying at the ceremony. And then the Koreans watching this, and they talk about this, again, they're called Han, which is, it invokes this injustice that they felt historically. So they, the internet went wild, and they complaining to the judge and International Figure Skating Association. But anyway, there's a big article on her incident and then the connection to Han. Okay, so the Han family creates the need to feel big in some Koreans, which lead to very short-tempered and prefer speed to elaboration because they are anxious to get big and successful as quickly as possible. And based on my anecdotal experience with Americans and Koreans, and this is something that I repeatedly observed in my friends, and including myself, it's everything you have to do quickly and get it done, and so that the byproduct of that will be you make a lot of mistake doing so. And so the next one, so then when you fail to become big, the failure of most Korean to achieve big is thought to result in widespread psychopathology, including a guilty feeling for not having fulfilled filial duty, and inferior complex for falling behind others, and anxiety over paranoid thoughts, fear of being ridiculed. The next one is called Hwabyung, and Hwa means literally translation is fire, and the psychological the meaning of fire is anger, and then the byung means illness. So Hwabyung, we call it anger illness or fire illness, which was part of listed in the DSM-4 as a culture-bound syndrome, but in the DSM-5, it's not there anymore. And so, based on the Chinese medicine, your health is determined by the harmony among 5 elements, and then harmony between yin and yang. And so, when you have a yin deficiency, which activate the fire element, which lead to anger. And so that the cause of the fire illness is again, it's very similar to connected to Han. It's a perceived personal injustice, hardship, family conflict, financial difficulties, and loss of loved ones. And this is a very, very commonly seen in the uneducated married woman with a low SES, which this is a group that going through so much hardship and then repress their feelings and endure a lot of hardship. So then the symptoms there are 2 types of symptoms, somatic and the non-somatic. Somatic symptoms are more geared toward the GI symptoms and the vomiting, more indigestion, and you feel so hot and you have to go outside even in winter. And then the burning sensation in the chest, and non-somatic symptoms including anxiety and depression, panic, and fear of impending death or insomnia. Here's MMPI item called "There seemed to be a lump in my throat much of the time." It's the item number 11. As you predicted, Korean woman, 27% compared to American woman. Actually, I was interested in this culture-bound syndrome way back in the early 2000s. So I and my colleague, 2006, we using MMPI-2, we have us and then Korean psychiatrists pick the item from item pool that associate with a Hwabyung construct. And then so we come up with final 18 items. And then 2010, we validate this Hwabyung scale. I haven't done much since then because the Hwabyung patient it's very hard to get it in Korea. But anyway, so something that I'm pursuing later in my life. Okay. The last psychopathology is alcoholism, which we Koreans refer to as Irish of Orient, and then drinking is very acceptable. So the drinking is not, it's just alone. It's a more social gathering, and people get drunk and go outside and they, singing and crying and laughing, and it's very acceptable in society. So, and even its interesting thing is, compared to Chinese, Koreans tend to have a higher rate of alcohol-related problem, alcohol abuse. And it was found that the last say that because of this because Koreans tend to not turn red quickly, that may play an important role in the alcohol abuse compared to Chinese. And but anyway, so the alcoholism, again, it is not really labeled alcoholism. It's just such a socially acceptable way of celebrating, either happiness or commiserate when you have a death. So it's just something that, as any gathering, alcohol is always the main, the source of communication. Okay, so you see here's MMPI item 527. After a bad day, I usually need a few drinks to relax. Would you say yes? 14% American normative data. So again, I'm talking about this normative sample who represent U.S. It's not based on only small group. And then Korea, oops. I don't have the slide. Let me see. I don't know what happened, but I can. I think 29. Okay. Oops. $27. 27, was it? Okay, so we talk about the Korean cultural factor that need to be considered when you're working with Korean in general, and talk about philosophy and values. And we talk about three things: Confucianism and Buddhism and shamanism, how those three value systems impact the way Koreans think. And the personality psychopathology, we talk about Han and Hwabyung and alcoholism. Move on to next. I will introduce the Korean MMPI-2, and so that there are three subtopics that I want to address, and talk about the brief history of English and Korean MMPI measures, and then move on to Korean MMPI-2 adaptation stage, and then brief introduction on psychometric properties of Korean MMPI-2. If anybody I can send you this slide, so if you can give me the address, yes? I can. Okay, we'll talk about that in the third, when I address third topic. Okay, here is a brief history about MMPI measures. And so as you all know, MMPI was published 1943 by McKinney and Hathaway at University of Minnesota Press. And 20 years later, MMPI was translated and adapted in Korea, 1963. And MMPI was revised and using better norm, and the controversial items dropped. So the MMPI-2 in America was published in 1989. Interestingly, the same year, the second version of MMPI it's not MMPI 2. It's an old MMPI, but they did the second revision. And so that item is much improved using better norm, but it's not MMPI 2, it's MMPI. In US, MMPI adolescent version was published in 1992. 2003, restructured clinical scale were added into MMPI 2 manual. In 2005, the MMPI 2, Korean MMPI 2 and Korean MMPI A was published. 2008, MMPI 2 restructured form. I don't know how many are familiar with MMPI 2 RF. Okay, it's a shorter version. All the items in MMPI RF is from MMPI 2, so it's not a new instrument. And the interesting thing about MMPI 2 RF has only 338 items, and then no clinical scales included, only RC scales. 2011, we revised MMPI 2 manuals, and I'll talk about that later. And also, we published Korean MMPI 2 RF. And either this year or next year, MMPI A RF will be published. And I am going MMPI conference in Arizona next month. And so then I will hear insights about when this will be published. And I know that it's very soon. They're working on a manual, so. Okay, so now I'm going to talk about this long process that I went through to develop MMPI 2. There are 5 stages that I divided. The first stage is associated with the translation itself. So stage 1, 1989 and 1991, that's when I was a graduate student in University of Minnesota under supervision of Dr. Butcher. And so I was second-year graduate student, and he said, why don't you translate American version into Korean? So that's how everything is started. So I and another bilingual graduate students in University of Minnesota independently translate all 567 items into Korean language. And then we met and come up with the first draft of Korean MMPI 2. And then I want to see if our translation is better or worse than the old Korean MMPI, because there's a lot of items still overlapping, old MMPI and then MMPI 2. So we had third bilingual graduate students to review those items. There's MMPI has 566 items, MMPI 2 has 567 items. There are some quite a lot of item overlapping. So I picked only the item overlapping and then have them to review it. And then this bilingual select which one is more accurate, and then it sounds more natural. And then 3 of us met, and then we come up with the second draft. And then the fourth bilingual translate all 567 items from Korea to English. And then Jim Butcher, which was my advisor, reviewed these 2 English versions, one back translated and then one original one. And then he picked 20 items, say, oh, there doesn't seem equivalent based on his rational judgment. And so then I translate those 20 items. Okay, stage 2 is when actually I do my dissertation. This is my dissertation project. And I went back to Korea and I collected data from Korean college students, 726. And then based on my the preliminary result, which is my dissertation, and I picked 100 items found to be a little controversial based on item analysis. And then I retranslate those 100 items. And then once that's done, and I submit the last updated version to University of Minnesota Press for the approval, and they send my translation to independent translation agency to reviewing. And then they said that maybe I should retranslate 50 items. And so to another translation. So it went through a lot of translation, retranslation, and then stage 3, that's the when I actually found a publishing company in Korea called Sarang, and they are willing to support the standardization project. And so then they review the items again. So the 170 items revised because it's a minor revision because I've been in US for quite a long time, and the way I write maybe a little bit less modern in Korean standard, and so they revised it. And then 13 items with a substantial change were back translated, and then back translated items were reviewed by 5 American psychologists. Okay, this M is missing. So this is the first Korean MMPI 2 manuals published in, thank you. Okay, and so 2003 and 2005, actually, so then this is when we do collecting massive data, normative data, and it's based on stratified sampling based on 2000 census, and then we have final sample of 650 men and 701 women. The last stage, we revised MMPI 2 manual because the first manual, we didn't include clinical data because we had some problem of collecting clinical data. Data were contaminated, and so we decided to collect the clinical data again. And so then in this revision, we include a lot of different samples in college and clinical, and so anyway. And then the unique feature about this one is we provide gendered and non-gendered norm, which is what American MMPI 2RF manual, there's no, it's all non-gendered norms. So to consistent with American trend being not really differentiate between gender, and we provide both. So this is our most recent MMPI 2 manual. Okay, I don't want to go through all these. So basically just telling you that this instrument is okay to use. So you don't have to pay attention to all these. So then this is just reliability. Okay, just looking at the bottom. So for example, you see that 0.78, 0.77. 0.78 is average stability, which is a test retest for Korean, and 0.77 is the test retest for American. So you can see it's very similar. So then the test retest, we call it stability, is fairly compatible across two. And then when you're looking at the second row, 0.8 versus 0.84, it's a little bit higher because these are the content scale. So when you work with the content scale, the content scale item tend to be more homogeneous so that their internal consistency or reliability is much higher than clinical scale. So just looking at the bottom row, you see that looking at the red and blue, their numbers are fairly consistent. So that's indicating that in terms of reliability, Korean MMPI and American MMPI are very similar. Okay, concurrent validity. So using our clinical data, 395, we correlate to self-report. MMPI is a self-report, and SCL90 is a self-report. So the first one, look at this one. So think about this. If MMPI scale 1, hypochondriasis, is measuring somatic complaint, then it should have a high convergent or concurrent, high correlating with SCL somatization. And that's what we find when you see that 0.67. And OC, obsessive compulsiveness, PT scale 7, appear to be highest. Depression, interestingly, it's not the highest. Still, it's 0.47 is substantial. But there are other scales predicting better, or they have a higher convergent, like PT, 0.66. Anxiety, as expected, MMPI-2 PT and SCL-90 anxiety scale converge fairly well, 0.6. Phobia, 0.51. Paranoia, and psychoticism. So overall, I would say it has substantial concurrent validity. Next one is very important. I don't know if you can see this one. When you think about when you're correlating two self-report, like patient fill out MMPI-2 and then they fill out SCL-90, and we call it, their correlation is really high because of what we call the method variance. So if somebody who over-report, they over-report both, right? So high correlation, it's hard to tell it's because of its high concurrent validity or it's because of method variance. One way to tease out those two is you can correlate self-report with a therapist rating or peer rating. So what you see here is I correlate MMPI scale with the therapist rating. So therapists who blind to their patient MMPI result, they go through 70 items, they rate. Okay, this patient complaining about fatigue, strongly agree, or this is a Likert scale. So when you see that the one that I highlighted means this is the expected direction. So patients who have high scores on scale 1 were rated by therapists. They complain about fatigue, and then they complain multiple somatic complaints, and then sleep disturbance, physical symptoms. So this is a very, very powerful indication that Korean MMPI is predicting what it's supposed to predict. So that there is a convergence between what the patients say about themselves and then what therapists viewing. So we are very excited about this result. Although there's some correlation is not expected. But anyway, I will send this to you if you want to. It's hard to see this one. Anyway. Again, okay, I'm not going through again. I'm going to stop here for the result. So we talk about three things: brief history of English and Korean MMPI-2 measures, Korean MMPI-2 adaptation stage, went through multiple stage adaptation process, and standardized with a representative sample, psychometric properties, fairly substantial concurrent and predictive validity, and very comparable stability and internal consistency. Okay, last one, which I'm the least comfortable with. It's the two learned factors to be considered in deciding which version of MMPI-2 should be used. If anybody is wondering why she doesn't show the mean profile, I saved this here. So I want you to look at this one. When you think about, Dr. McNear talked a lot about when you actually evaluate client, you have to looking at the cultural level, and then you have to looking at the unique background. So that the important thing is, especially in the Koreans living in U.S., in the language proficiency and acculturation, as you all know, is extremely important. because there's language and cultures are highly correlated, but it's not necessarily the same. Dr. McNear said there's a Japanese first generation and Japanese second generation. Their expectation is very different. And so second generation, they have probably very fluent, and yet their family very, all the decisions based on traditional Japanese system. Then their acculturation might be lower. The language proficiency is high, but the acculturation may be lower. So I'm not sure there's so many acculturation measures out there. And again, I've seen about over 50 different measures of acculturation. And I don't know what to, again, it depends on if a client is proficient, born and raised in US, you don't need to measure language proficiency. And then some acculturation measure include the language proficiency. So the commonly used, you probably know about SL, the self-identity. Have anybody used this measure in your client? This is a most well researched. I'm not sure it's the best, but at least in the Asian population, the Sun and Lu Asian self-identity acculturation is commonly used. So the point is, so think about this one. When you give MMPI to the client, the applicant, and then plot it to using American sample, there's a problem because American normative data, the Asian Americans are underrepresented. In a normative sample, there's only 6 men and 13 women. So that the norm is, maybe reflects, it may be proportional to the population, but it's a questionable whether use of American norm is appropriate. So I don't know, you can see this one. The SCI 1996, the study shows, and it's a college student, and they divide group into 3 based on acculturation level. They call low and medium and high acculturated. So the top profile, the scales are showing very elevated, which is produced from low acculturation group, which is what expected. But their elevation is extremely high. Like Dr. Kammer says, that when you look at this one, okay, this person, how do you interpret this one? Is this person really had that severe problem, or how do you interpret this? So, again, I'm going to show this one. I recommend using both norms. And so I'm going to show a little bit about, based on my research. Here, the orange line indicating American norm. You know the American norm is all 50. And these 2 profile, one for men and one for women, is from Korean normative sample. So think about Korean people who doesn't, just a general average person, when this person, say, plotted using American norm, and it shows that this person has a serious problem. F score is over 2 standard deviation above American norm. Here. F is severely elevated, and then scale 1 and 2 and 8, showing 1.5 standard deviation above the mean. So 1 standard deviation is t-score 10. and 1.5 is 15-point t-score above the mean. So clearly, it is inappropriate to use American version of MMPI-2 and plot the RAS score using American norm because everything is so elevated. So how would you do this? It's you know. So as you can see, man and woman, not much difference. It's very elevated. Okay. The third one that I want to address is suppose you give MMPI, Korean MMPI, and then plot in MMPI, the Korean norm. So I want you to look at this one. The blue line indicating, so then this is the Korean clinical sample, which has diagnosed various type of mental illness. And we use American norm and the Korean norm. And this is obvious because using American norm, everything is very, very elevated. But what do you see this, the blue line? Not significant. This is something that I was very, when I first saw, it was very intrigued because Korean normal people tend to be, they report so-called psychopathological, endorsed to psychopathological items so much that because of the ceiling effect, the psychiatric sample, their profile is very, very muted. It's kind of low. So the only suggestion I have based on my limited assessment experience, that if you're going to use Korean MMPI and plot it in a Korean sample, and if somebody shows T-score of 60, and that's something that you have to pay attention to it, because 60 is, I would consider elevated. So the third recommendation I have for now is you can maybe use a lower cutoff t-value for clinical elevation if you're going to use Korean MMPI. Okay, so we talk about importance of evaluating language proficiency and acculturation, use of both norm, source and target culture is recommended. And if you're going to use Korean MMPI and plot RAS score using Korean MMPI, maybe use lower cutoff t-value for clinical elevation. Any questions?